Good morning. My task today is to discuss the effects of crystalloids versus colloids on enteral nutrition tolerance. I have no conflict of interest to disclose with regard to that talk. So let's start with the background. Very recently, task force from the European Society of Intensive Care Medicine, as well as the European Society of Nutrition, have provided an excellent summary of the current knowledge about the underlying mechanism, clinical manifestations, and outcome related to acute gastrointestinal dysfunction. So as one can see here, in the blue box on the left of, the, of the graph, that there are multiple underlying mechanisms that may result in gastrointestinal dysfunction. Among them, altered bile acid homeostasis, impaired GI motility, alteration in the hormone responses, increases in intra-abdominal pressure, modifications in the microbiome, impairment in tissue perfusions, loss of the integrity of the mucosa, and of course, alteration in the immune response. The clinical manifestations may again be very various, with malnutrition, cholestasis, vomiting and nausea, illustrating the presence of gastroparesis, also bleeding resulting from gastric ulceration, might be also lactic metabolic disorders like lactic acidosis, and eventually these manifestations may result in life-threatening conditions like GI tract perforation, Ogilvy syndromes, major bleeding, sepsis, multiple organ dysfunction. So it is now obvious that fluid resuscitation has some impact on the gastrointestinal function. And for example, in this meta-analysis of 43 RCTs, there was nice evidence that the restriction of a volume of fluid for resuscitation was associated with lower risk of vomiting as well as of intestinal obstruction. In that cohort study of 86 mechanically ventilated critical patients, again, there was evidence that both the amount of cumulative fluid and the salt content of the fluid infused to the patients are major factors of critical caloric deficit in the critically ill patients. So in the current study, we aimed at comparing the effects on gastrointestinal function of a resuscitation with colloid fluids as compared to crystalloid fluids in critical patients with severe hypovolemia. We use the Crystal cohort. As you may know, Crystal was a randomized controlled trial that have evaluated in critical patients with hypovolemic shock, fluid resuscitation strategy with colloids to a fluid resuscitation strategy with crystalloids. So here is the flow diagram, and one can see of the 2,858 patients randomized in the Crystal trial, 1,552 were eligible for that ancillary trial on nutrition and gastrointestinal function. And one can see in that flow how the patients distributed with regard to the practical modalities for nutrition, enteral, both enteral and parenteral nutrition exclusively. And we did intent to treat analysis as well a per protocol analysis in which we considered patients who received only one type of fluid, crystalloids or colloids alone. So what were the major results from that ancillary trial? First of all, in the intent to treat analysis, so 555 patients were randomized to colloids compared to 573 patients randomized to crystalloids. But one can see that there was no major difference in the time to initiation of enteral nutrition, in median 1 day in both arms. And there was also no evidence for differences in the duration of enteral nutrition as an indirect indicator of the enteral nutrition tolerance between the two treatment arms. However, there was also not statistically significant some differences in the proportion of patients with vomiting that might have been higher in the crystalloid arm as compared to the colloid arm, without impacting in the cumulative amount of enteral nutrition that was prescribed or the cumulative amount of enteral nutrition that was actually received by patients. How does this translate into clinical outcome? As one can see here, there was a statistically significant difference in mortality at 90 days, with a 6% absolute increase in mortality in the crystalloid treated group, as well as a longer treatment with vasopressor in patients treated with crystalloids as compared to colloids. When moving to the per protocol analysis, that is again considering in the colloid arm only patients who received only colloids, and in the crystalloid arms only patients who received only crystalloids. Here again, one can see that there was no evidence for major differences between the two strategies for fluid resuscitation with regard to the initiation of enteral nutrition and duration of enteral nutrition. However, there was significantly more patients that had vomiting and gastrointestinal dysfunction in the crystalloid treated group as compared to the colloid group. Here again, without resulting in impairment in caloric intake in between the two treatment arms. And that translated into some differences in terms of clinical outcome, with significantly more patients who died in the crystalloid arms who died at 98 as compared to the colloid arms, and also a longer duration of mechanical ventilation in the crystalloid treated patients as compared to the colloid treated patients. We further now looked at a subgroup of patients at particular risk of malnutrition, that are the patients with low body mass index at baseline. So here one can see again that the two types of fluid strategy did not differ in terms of initiation and duration of enteral nutrition, but here again, crystalloid treated patients were more likely to suffer from vomiting and gastrointestinal dysfunction as compared to colloid treated patients, with a significant impact on the tolerance of enteral nutrition, with patients in the crystalloid arm receiving much lower caloric intake than patients in the colloid treated arm, with some translation into differences in clinical outcome, with significantly more patients who died among the crystalloid treated patients compared to the colloid treated patients at 28-day and at 90-day as well, and a longer duration of requirement of vasopressor in the crystalloid treated arm compared to the colloid treated arm. So in conclusion, this study in critically patients with severe hypovolemia found that fluid resuscitation with crystalloids was associated with a higher rate of vomiting and mild to moderate gastrointestinal dysfunction as compared to colloid resuscitation. There were no evidence for difference in the tolerance of enteral feeding between resuscitation with crystalloid versus resuscitation with colloids. And finally, In the subgroup of patients with low body mass index, those who might be at higher risk of malnutrition as compared to a strategy based on colloid infusion, the strategy based on crystalloid infusion may be associated with a greater risk of acute gastrointestinal dysfunction, resulting in negative impact on mortality. Thank you very much for your attention.